Our goal is really to find the end of breast cancer and to eradicate it once and for all. And to do that, we try to do research, inspire research, facilitate research, and really drive the process to getting to the cause. When I went into practice as a surgeon, there were no women surgeons. It was back in the 70s, and I hung up my shingle, and they wouldn't send me any patients. So the only patients that were referred to me were women with breast problems. They didn't want to send me any guys, and so, God forbid. So I found out at that point that women were not being treated very well, and that I could make a bigger difference taking care of women with breast problems than I could people with gallbladders or men with hernias. And that's really what started me into it. It was just around the time that things were changing. We had data that maybe lumpectomy and radiation was just as good as mastectomy, and yet women in this country were not being told that. We had the women's movement coming up and women starting to demand more information, but a medical system that was not really prepared to give it to them. And so it really was the right thing at that moment to grab a hold of breast cancer and try to change the way things were being done. You know, we really try to focus at the Dr. Susan Love Research Foundation on areas that I think are not being taken care of by other people. And there's a lot of research going on in the molecular biology of breast cancer, trying to figure out what the cells do. There's a lot of epidemiological data, but there's really not very much focused on the breast. So the research that we do here ourselves is focused on trying to figure out the breast. It's very interesting that we know every signal transduction pathway in the cancer cell, or most of them, and yet we don't know how many holes there are in the nipple. Now, most breast cancer starts in the lining of the milk ducts, and yet we don't know the anatomy of the milk ducts. We don't know how they work. So we're doing research trying to map the ducts. When you get breast cancer, it's only in one ductal system. So if we actually had a map of where the ductal systems were, that would be able to direct surgery a lot better. We're also looking at how does the non-breastfeeding breast function? We know a fair amount about breastfeeding, more about cows and goats because that makes more money, but a fair amount, but we don't know what happens in the resting breast. I mean, what does your breast do when you're not making milk? Just hang out? We have no idea. You know, it's really pretty magical that it can make blood into milk, so it's got a lot of capability. And is it just doing nothing? Well, we've just finished some research which shows that it actually doesn't just passively pass whatever is in the blood into the ductal fluid, but some things are concentrated, some things are absorbed, and it's much more complex than anybody's ever given it credit for. So if we're going to look at what causes breast cancer, it makes sense to me to get to where it starts and to look in the organ where it starts and see if you can figure out what the conditions are that then lead for people to getting cancer. And that's the kind of research we do. You know, the treatments for breast cancer are pretty good. They're not great, but they're okay. The problem is we probably overdo them. What we're finding is it's not just one cancer cell that slowly gets bigger and then gets big enough and gets out. And so you have to do something to take care of all those cells that got out. But it's probably 5 or 6 different kinds of breast cancer. And each one is different. It gets caused by different factors or different circumstances and responds differently to treatment. So where chemotherapy works very well in some kinds of breast cancer, in other kinds it has no benefit whatsoever and only side effects. So the problem with some of the treatments we have, whether it be chemotherapy, hormone therapy, surgery, radiation, are they're all limited and they all have significant consequences. And we really need to either both refine better so we match better the right treatment to the right patient and also figure out how we don't need those treatments altogether. The interesting thing that we're learning about breast cancer these days is it's not just the cancer cell. We've sort of thought about cancer as if it were a foreign invader. It comes from somewhere else, it attacks, we got to blast it away, and that's slash, burn, and poison, as I've been known to call it. And really, it is a terrorist, but it's not coming from somewhere else. It's coming from our own breast. We grew it ourselves. So it's much more like Osama bin Laden. It's not like Osama bin Laden, actually. It's more like Timothy McVeigh. It's our own homegrown cancer cell. And that cell is not in isolation. It lives with other cells. And there's fat cells and fibrous tissue and blood vessels, and all these cells are interacting and affecting each other. So you need two things to end up with what's clinical cancer. You need an abnormal mutated cell, and it needs to be in a local environment that's egging it on. So it's like having a kid that's got bad tendencies growing up in a bad neighborhood with gangs and drive-by shootings and drugs. And if you take that kid and you put him out in the country and you send him to the Boy Scouts and church and he's on the farm, the same kid could turn out very differently. No change in their DNA. So really, where alternative things function in breast cancer is probably not about the mutated cell, but it's about the environment around the cell that either encourages or doesn't encourage it. We know, for example, exercise will reduce the risk of getting breast cancer and reduce the risk of recurrence. Now, why would exercise do it? It doesn't affect breast cancer cells, but it does affect the whole environment in your body. Meditation, same thing. Stress reduction, same thing. So I think there's a place for both the alternatives as well as the treatments that are trying to kill the cells. The big example to me is cancer of the cervix. When I was in training as a surgeon, if you had an abnormal pap smear, you had a total hysterectomy. You lost your fertility because we didn't know what else to do. And that was just one abnormal pap smear. And then we figured out that you could do less things, local things, and then we figured out it was sexually transmitted, and then we figured out it was a virus. And now we have a vaccine. So in 30 years, we went from not knowing what we were doing and cutting out normal body parts to prevent a disease or treat a disease to having a vaccine that can prevent it. This is doable. We can figure out breast cancer. There's no reason we can't figure it out. So the question is, why aren't we figuring it out? And I think there's a number of reasons. One reason is, I think in some ways we're victims of our own success. I think we've raised so much money for research that is not being spent that well. Another reason is a lot of the research is taking place on rats and mice, and not so much on women. And rats and mice don't normally get breast cancer. We have to give it to them in order to do the research on them, and it doesn't always translate into women. When I asked the scientists, how come, why can't you do this on women? They said, women are too messy. We can't control them. We can't control their genes. We can't control what they eat. We can't control what they do. And with rats, we can control everything. It's nice, pretty science. Well, and women aren't pretty science. But of course, the goal is not pretty science. The goal is eradicating a disease. So we decided, and they said then, just in passing, I don't know how we're going to find these women. So right now, we launched the Love Avon Army of Women. We're recruiting 1 million women who are willing to participate in research to find the cause. Women who don't have breast cancer, women who've had breast cancer. Because if you don't compare the women who get it to the women who don't get it, you're not going to know the answer. And we've now got about over 300,000, 356,000 or something along those ranges. 80% of the women who are in the Army of Women have not had breast cancer. So the vast majority of them haven't. Scientists come to them with their studies, and then we blast them out to everybody in the Army. And if you fit, you RSVP, and then we hook you up to the scientists and move the study along. And it accelerates the research so we can try out ideas, find the answer, and move on to the next idea as fast as we possibly can. This is one way to move us faster to finding the cause of breast cancer. It's not the only way, but if we don't start looking at really crazy ideas and new ways of thinking about it, we're not going to get there. 80% of women who get breast cancer have no risk factors. They did everything right and they still get it. So that means we don't have a clue what causes breast cancer. We barely know. And if we don't start looking at weird ideas and weird opportunities, we're not going to ever know.